Okay, okay, sir. Good evening to all. Sir, am I visible or not?
Not visible. You can.
Yes, actually, sir, camera is not working. Maybe
Okay,
next
okay.
time I will
No, no problem.
find. Okay, good evening to all IFPH members and doctors. A warm welcome to all friends and homeopathic doctors. Keeping a 1 minute silence. Today is 1992 day of uninterrupted daily webinar of IFPH on 13th February 2026. And our today's guest is Dr. VIBHA MEVADA SHARMA, BHMS, CCAH, MCAH, YPI uh, uh, consultant at National Homeopathic Commission for Homeopathy, and she is director at Dr. Vibha's Homeopathy, Ghaziabad and Noida. Her passion about homeopathy gives her fame in few minimum duration of 7 years with huge number of difficult and successful cases. And her today's topic is homeopathic approach to manage ankylosing spondylitis case report. Okay, ma'am, you can proceed. You can start your presentation.
Thank you so much, doctor. Am I audible?
Yes, ma'am, you are audible.
Yes. Give me a minute. I'm sharing my screen. Is my screen as visible?
Yes, it is. You are opening now, but it is not yet fully opened.
Okay, the PPT is not there.
Then you just start. Do one thing. You may stop screen sharing and restart again.
Just give me a minute. I'm just stop sharing my screen and re-sharing it. So, good evening, everyone. Thank you so much, doctor, for your kind words and the introduction. As I'm going to present a case report of ankylosing spondylitis today, and the purpose to choose this case to present is to just explain that with simple and the common medicines we can handle a rare disease condition, and how we can do we'll see in this case report, right? So before going to start our session, I just like to dedicate my whole work to my gurus. And before going to start the case, in short, let's see first what the condition is, because whenever we are dealing with any case, especially the grave pathological cases, we should know the pathology very well first, right? Which will help us to diagnose the case as well, which will help us to treat the case as well, right? Because in repertory as well, we see the rubrics by the name of disease, and if we don't know what the disease is exactly, we can't treat the patient. So, ankylosing spondylitis is a chronic inflammatory disease, we know. Basically, the patient with this disease develops the stiffness, especially of a spine. So, technically, there is a reduction of gap between the two spinal cords, which creates a less flexibility of spine. There is a stiffness is there. There is fusion of two vertebrae, and which can lead to a hinge posture. Yeah, you can see in the second image. So basically it developed in the vertebrae, but as well it can be developed in other joints as well. This condition is called rare one because the 1 to 2% of individuals which are suffering from the ankylosing spondylitis can develop the HLA-B27 genotype positive. Right? This is in short about the disease condition. And we can confirm the condition by the lab test. So when my patient come to me, they already came with the pathological reports. as the condition is chronic, patient is already under allopathic treatment. They tried so many things till the condition they came to me. So when they came, it's clear that the patient is positive with the HLA-27. The CPR is high because the inflammation is there. RF factor is positive.
Ma'am,
And
excuse me, your video is not visible, ma'am.
my video is
Ma'am, your camera maybe. Slides are visible, but your camera, ma'am.
just a minute, is it visible?
Yes, ma'am. Yes, ma'am. Ma'am, go
Okay,
on.
okay, okay. So I said the patient came with the reports. The MRI reports clearly shows that there is an angular disc bulges are there. The more effect is on L4, L5, L3, L4. Yeah. So patient already came with the report, the symptoms, and with the history of, that much of files, because they tried so many things till now. So this, when the patient came to me, this is the known case of ankylosing spondylitis with chronic obstructive pulmonary disease. Patient have hypertension as well, and when they came to me, first time they come to know that the patient is pre-diabetic as well. So let's see, with this multiple problems, how can we treat the patient with the single medicine in homeopathy. So this is the preliminary data of patient. Male patient is of a 47-year-old. By education, he is a BA. In occupation, he is doing a job in industrial hydraulic as a service engineer. So first time the patient visited to me on 29/9/2019. And as I started talking to patient, the patient shows in his first paragraph of our case taking, the patient shows concern about the family first. The first concern of the patient is like, I have so many problems. He is very aware about his disease. So he have a fear that if something happened to me, how my family will survive, because he is the only earning member of the family. He's like, what will happen if something happened to me? How my family got survive? How, if there is no support, how they will survive? And he is like, support is very important in the life. As well, he is concerned and is stressed about the health of parents also. When we talk about his childhood, he said, since his childhood, he was living in the maternal uncle's place for the study purpose. And at this age, even the patient is like, I am feeling that I doesn't got that love of parents. Then he said, I have few number of friends only, but since long I am in contact with them and still they are my constants. Then he said, I can't talk openly. Even now, even after so much, jobs and everything, even at this stage, I can't talk openly. And he's like, I got married in 20 when he was 22 years old, and the married life is quite satisfactory for him. When we talk about his workplace, the patient explains that since last 24 years, he was working in one company only. Yeah, this thing indicates something about the medicine, about the personality of the patient, about the drug picture of the medicine or of the remedy. He said, I got promoted so many times, but since last 24 years, I'm in the same company. Another thing, in this long years, I never been late. It's like a rare condition if I got late to reach at my workplace. He's like, I like to be on time always. When we asked more about his life, he explains the most painful time of his life. And that was when he lost his brother in 1999. He remembers everything very well. By one, step by step, he explains everything. And after that, he lost her sister as well. And she died because of the blood cancer. Then in 2005, he lost his son as well, when his son was 22 years old. In 2007, his daughter left the house. She shifted somewhere else alone because of some family issues. And when we asked his experience throughout the events, all the painful events of the life, he explained that I hurted a lot. And because of the hurted feelings, I'll end up with the forgetfulness. I feel that after every event, my memory is getting less sharper. My memory is like I started forgetting things. So when we took a detailed talk on the chief complaint, how it started. So at the age of 16 only, first time his backache start. Then he took some medicines, and after that the knee pains started. Again he took some allopathic medicines which make him feel comfortable for the 2 years. And after that, on off some pains are there, and whenever the pain are there, he temporarily took some painkiller or something like that. And finally in 2010, he come to know the proper diagnosis that he is a HLA-B27 positive. And after that, from 2010 onwards, he's taking painkiller on daily basis. He explains that if I doesn't took painkiller, I can't sleep. I can't do my routine work. And time a day, painkiller is compulsory for him. So since last so many years, he is taking painkiller on daily basis. Right? If we saw the family history of the patient, the same kind of disease we doesn't found there, but the paternal aunt have asthma and hypertension, mother have hypothyroidism, maternal grandfather is died because of the brain hemorrhage, other is one of his sister is died because of the blood cancer. This kind of pathologies we found in the family history. When we go on the generalities, there is an intense desire for sweet things and severely aversion for cold things. If we see the thermal of the patient is more towards cold, so the patient is chilly, and there is a particular place of perspiration that is on the upper lip. Another PQRS we found in his sleep pattern, that at this age even patient can't sleep alone. and in a dark room. He need a small light to be open must in the room. And as because of his job, if he have to travel somewhere else and he have to stay in the hotel room, that's too alone. He used to keep all the lights on and the TV on, and then he can sleep only. Yeah. And if the lights are not on, he feels anxiety. There is repeated dream are also there. Yeah. So just at this point, keep this remarkable that dreams are only valuable to consider in your analysis if it's a repeated dream, right? So there is a repeated dream of dead people, those who are died in family, like brother and sister, and how he feel in the dream is important to know, to consider in analysis of the case. So he feels good there. This is about the case, right? So on the basis of this data, what we got from the patient, the following rubrics are selected for the case. First thing is company desire for alone aggravation being, right? Because he can't stay alone, absent minded, anxiety alone while, excitement, excitable element from aggravation, mental and emotional consequences of, forgetfulness, which is important rubric for this case because forgetfulness develops after the hurtful events of his life, and as a effect of getting disturbed in the life. There is anxiety during sleep, perspiration upper lip, in the generalities food and drinks, sweet desire and the cold aggravation, right? So when we put all these rubrics in our repertory chart, two medicines are there which cover whole the selected rubrics. But always select the medicine not on just because the medicine is on the first or second place in repertory chart, because repertory shows what we put in the repertory, what we are searching, what we are understanding out of case, we are putting in the repertory chart. But to ensure your prescription, we have to see the materia medica as well. So for this case, I prescribed Kalika 1M, which is there in the second position in our repertory chart. And why I choose Kalika here? If we see the life journey, if the routine of the patient, we saw since last so many years he is working on one place only. The dedicated person, very punctual, can't be late in years. There's the quality of Kali peoples. Yeah. Other thing, if we try to understand about the Kalika, so here these clips are from the Soul of the Remedies, the book which is by Dr. Rajan Sankaran sir. Here we can see the main theme of Kali Carb is the vital fear and reactivity, which is the quality of carbon. And that is seen when a person lacks the support of a family or a group. The patient feels the same thing for his own family. If I am not there, unka kya hoga? Which is the quality of a Kali peoples, the Kali family. The main symptom of Kali Karp is the fear of being alone and the desire for company. Again, which is very markedly present in this case. Other thing mentioned about the Kali Karp is her dependence on the group or family is so great that her entire life revolves around her family. So if you note it, as the case start till the case end, patient talked about the family only. All the issues, all the problems, even in dream, everything is around the family only. Yeah, when the forgetfulness developed, how it develops? Because it loses the family members one by one. Yeah, the health of the family members, the integrity of her family, the amount of support she gets from the family, everything is rolling around the family only, which is there in our case as well. If we read more about the Kali Karp, the dream of dead relatives, see how perfectly the match is there. And Kali Karp shows her extreme concern of her family. Because the extreme concern of family is there, the dream of dead peoples of family is there. One of the big aggravation factor for Kali Karp would be the sickness of any member of the family. And that's why he was more concerned about the health of parents, especially the supporting ones. And parents are there in the life as a support only. She feels forsaken when he doesn't get support she needs. Another thing, in the book it's mentioned that in the clinic the Kali carbonicum patient can be a very faithful patient. You know, the punctuality, what we find out in the work, we can see that discipline everywhere in the life, in the every action of the patient. They are the routinistic people. You know, the days start with 1 2 3 4 5 in the night and again start with the 1 2 3 4 5. They are the routinistic people. If their routine is break, they get aggravated, and they're enjoying with being in the same routine. That's why they are the faithful patients. Even you forgot to tell them the date of follow up, but they will ask you by their own self that when I have to come back. And on the same date, they will back to you again. Even before the follow up date, they will come to you if they doesn't have time on the follow up date. Just find out this quality in the Kali patients. Follow-ups quite regularly and is sticking with the same doctor for the long time. Yeah, this is another quality of them. If you have a Kali patient, since years they will be with you. If they stop treatment with you and they develop some other symptom in the life, they will contact you again. Yeah. So this is about the Kali patient, and because of these qualities of the patient as well as the simillimum match of the remedy, I prescribe the Kali Karp 1 m to the patient. After 1 month, the first follow-up, there is slight change in pain only. And that's too in the initial days. When I give the single dose of Kali Karp 1 m, Initially few days there is a slight change in pain, and after that again the same kind of pain started. So this time in the first follow up, I shifted patient to the LM potency because I realize here the pathology is high, and because the pathology is here, the repeated dose is required. And here we can beautifully use the LM potency for the continuous repetition on daily basis. So Kali Carb 0 by 2 twice a day for the next 30 days was prescribed in the first follow-up. And what we saw in the second follow-up is, now in the second follow-up, pain are not continuous. But if if we do some extra exertion, it's like before only. The pain is like before only. If exertion is there, the slight exertion is there. If he stirs up 2-3 times out of his routine, then again the pain started. So here I kept the same medicine with the same potency, but this time repeated it 3 times a day for another month. Right? So on, in the third, fourth, every month follow-up was there. But in the webinar, it's not possible to show the years of follow-ups. So that's why I show the follow-ups in gapping with the months. So in between, after 4 months, I shifted the patient to Kali Carb 0 by 4, LM4 potency. In 6-month follow-up, first time the patient explains that out of this long years, I stopped taking painkillers since last 1 month. Yeah, and we are still continue with the Kali Carb 0 by 4 3 times a day. After 12 months, in the whole months, like 7, 8, 9, 10, 11, every time the medicines are same with the same potency. And in the 12th month, when we do all the pathological reports again for the blood pressure and diabetic, like that reports. So what we found, the hypertension, the chronic obstructive pulmonary disorder, and his pre-diabetic symptoms even are much, much better. The pain is much better now because he himself stopped the painkiller. He said, I doesn't feel to have painkiller because I doesn't feel the pain now. And from the 6th month to 12th month, the painkiller was completely stopped. He was not taking painkiller, but he is on the medicine. And last follow-up, I took on 28th November 2025, and still patient is not taking any painkiller. Now even since last few months, he was not taking homeopathic medicine even. But still, he is feeling better. The pain is not there and he is not taking painkiller. Right? Okay. So, as I show the before reports already, at the end I told patient to repeat the MRI and all, and patient is not convinced to go with the lab reports again. So I took the video testimony of the patient. And I want every one of you just listen this video testimony. Might be, but okay. So there is a link of YouTube in the end of the screen. There is a link of YouTube. You can watch this on YouTube as well. So might be the voice is clear there, because in my system the voice is high, still it's not audible there. So patient said that initially how repeatedly he was taking the painkillers, and now he was completely free from the painkiller and all. So he was just explaining all this thing about his case only. So I just request everyone, please take the screenshot or something of the YouTube link, or I will provide link in the chat box as well, and you can see the testimony there, as the video or audio is not supporting here. Okay, so this was about the case. And as initially I explained that the motto to choose this case is Kalika, we can prescribe in so many acute cases, in so many different diseases. Easily, commonly we are using the Kali family medicines, especially the Kalika. So here, for the treatment of chronic or the rare diseases, we doesn't need to, go with the rare or the mother tincture or some other supportive medicines for the patient. Here I just want to explain that with the use of common medicine, with the use of single medicines even, we can treat the chronic and the rare diseases as well, right? So this is about today's case and today's presentation. Thank you so much. I like to express my gratitude to IFPH for giving this opportunity so many times to present my thoughts and cases on this platform, and congratulate IFPH for doing continuous work. So if you have any question, you are welcome.
Thank you, ma'am, for a informative presentation about ankylosing spondylitis. Ma'am, I have one question.
Yes.
As Dr. Honeyman guided in Ognon, that in acute cases we repeat daily single dose, single medicine, but in chronic cases and light cases like autoimmune disorder, we have to wait at least 1 month, as you have told that Kalika 0/2 you have repeated daily.
Yes.
So I want to know behind this,
Okay.
as the case is chronic one, na?
Yes, case is a very chronic one. See, if we see the organon, where there is written about the use of 50 millisiemens potency, clearly mentioned that we can use it for the first thing is why LM potency develops, because we can use it safely in repeated mode, right? Repeatedly we can use it, even in 15 minutes we can use the LM potency in acute cases, as well in chronic diseases also, where the disease is progressive, right? Where the disease is progressive, we can use it.
Okay, ma'am. Okay,
Yeah.
okay.
When the disease is
Got it.
progressive, na, the pathology is progressive, means the pathology is developing every day. So we have to match the potency on that level. That's possible with the repetition of the medicine, because 1M potency we can't repeat on daily basis. 10M potency we can't repeat on daily basis. Although when I prescribe the single drug, always I wait for the result and wait for the second prescription. But as the disease is progressing on daily basis, the symptoms are very high. Patient is in pain. We can't wait for days and months, The pain reduction should be there. Right? That's why the 50 millisiemens we can use in chronic cases as well for the repeated mode.
Okay, ma'am. Got it. And so it means that single dose in chronic cases and in LM potency, we can repeat as long as patient needs.
Hello.
Hello,
Yes, sir.
am I audible?
Audible. See,
Oh,
when to stop the medicine, there is the criteria mentioned already in organon till the
mm,
patient reach up to the 80% of cure. We need to repeat 50 millisimal potency there.
oh, okay,
After
ma'am.
that, we have to stop the medicine,
Okay, okay,
right?
okay,
It's mentioned
okay,
in organon as well.
okay, ma'am. Thank you, ma'am. Ma'am, is there any preventive methods, or you can tell about any prevention for this condition?
Okay.
Uh,
Whenever we treat the patient like this condition, like in this condition, where the pathology is high, patient is in a pain only, right? So many things are there. First thing, always in all the patients of mine, either the autoimmune disorder is there, either the hormonal problem is there, either the lifestyle diseases are there. We should explain our patient about the diet. Yeah, in every patient of mine, I use the three things must, right? First thing is the medicine which I have to select to give them. Second thing is about the diet. I am guiding my patient in which condition they have to avoid, what are the food products they have to avoid, right? And the third thing is about the exercise. As I have degree in yoga as well, I always prescribe some yoga asanas, or some whatever they like. So many people doesn't like to do yogas. So like you have to walk at least. This patient was going with the physiotherapy as well, right? Because if you only depend on the medicine for all the condition, you will not going to get the result well. In so many conditions, other criterias are very important to maintain, or very important to suggest to your patient. See, homeopathy, when we say homeopathy work, in so many diseases, like in chronic cases, in rare conditions, but as well you have to prescribe the diet and their daily routine, like whatever exercise they can do and whatever exercise is good for the condition. So we can't wait for our single drug or single dose to work for all the things. If the patient is come for the diabetes or for the obesity, we can't say them to you can eat sweet or whatever you want, but this single dose will work for you. No, we can't do that. We have to guide them what are the fruits, what are the sweets they have to avoid to maintain their sugar levels. If we talk about the sugar, which is a small thing, which is a lifestyle disorder, so whatever conditions we are handling, we have to see the diet and the exercise in all the cases. And I am doing this in my practice, so I feel that whenever I got a very good result, all this triangle, medicine, diet and the exercise is there, then the patient got a very good result.
right, ma'am. As Dr. Honeyman also guided in
Yes,
organ about the regimen in acute and chronic diseases, and
yes.
you also told very nicely about this. And if anyone have any question, uh, then they can ask or send a message in chat box. And ma'am, we have still 15 minutes. If you
Yeah.
can tell uh, any new case, any old cases like this.
Yes, Dr. Rajita, please listen. Dr. Mr. Taciturn lady raise the hand. Did you saw it?
Good evening.
Yes, please.
Yeah.
Thank you very much for this nice presentation first. My question is this. Since this is a chronic case, you know the repetition is necessary, but you have started with 1M, a high potency. What is the logic behind this?
Okay.
What did you obtain since after 1M you get only a slight improvement?
Okay. So, sir, why I select the 1M potency first, right? So, in cases where emotions are there, which causes to develop the symptom, yeah, because of the repeated experience of emotional things like death of son, death of sister, death of brother, and every time out of all those incidences a same kind of experience was there, which is the forgetfulness of memory, yeah, which is a very marked there in the case, right? Means the patient is talking on the emotional level, the patient is talking on the experience level, and that's why the higher potency 1M was prescribed, right? But when I prescribed 1M, in the follow up, when I get the first follow up, what I saw there, that patient was slightly get better, right? When the patient is chronically suffering with some problem and they come to you, we have to do something where we can fast it relieve them, until otherwise your patient will leave you, they will stamp that homeopathy doesn't work, right? And just because I can't repeat 1M potency repeatedly, I go with the 50 millisimal potency, because 50 millisimal potency is developed by Hahnemann sir just because they want to repeat the medicine very frequently, right? And that's why I'll end up on the LM potency in the second follow-up.
Okay, thank you very much.
Most welcome, sir.
Ma'am, there is one more question in chat box. What are the other medicine you can use in this condition?
See, if first thing, the cases like this, better to go with the specific medicine which is there on the basis of the patient's symptom, right? In this kind of condition, if you go with the therapeutic prescription, patient will not going to get that much result, in this case, as we see, the painkiller is completely off and still the patient is not taking painkiller, and this can possible with the perfect match of the patient personality to the perfect match of the drug picture. And when these two things perfectly match, you can get a long term effect. If you go with the therapeutic condition, therapeutic medicine for the condition only, that will not going to work that much long for this kind of condition where the pathology is progressive on daily basis, right?
And there is one more
Yeah.
Jolly PS ma'am raising hand.
Yeah.
Ma'am, you can ask. Please unmute yourself. Hello. Hello, ma'am.
She's unable to unmute, I thought.
Yes, ma'am.
Yeah.
So anyone have any
Hello?
question?
Yes.
Yes,
Yes, ma'am. You can ask your question, ma'am.
Madam, that ankylosing spondylosis, is there RA factor present in blood? It is seronegative spondyloarthritis because RA factor is negative and HLA-B 27 is present. Is it not, madam? Is in this case RA factor positive?
Yeah. In this case,
Ang-
RF factor is positive. I saw the report in the starting, if you remember, the RS factor is
Yes.
positive.
Oh, actually, seronegative is mentioning as seronegative spondyloarthrosis. But in this case, RF factor is also present, is it not?
Yeah. But both
Ah,
both the conditions are there, na?
yes,
Patient is
yes.
there with this condition. Yes.
Now that combining case is increasing. Okay. And is there calcification in the muscles of the respiratory? No, in that lumbar spines, is there calcification occurs in this case?
See, in this condition now, what happens? Two spine in between the two spines, there is a reduction of gap, and there is a fusion of these things. There is a
Vertebra.
fusion of two vertebrae. This
Okay, that is
pathology.
bamboo spine. Bamboo
Yes,
spine as
yes.
we are.
A little bit, so see, the bamboo spine is little bit different from the condition, but the patient is not exactly of a, bamboo spine. The patient is of ankylosing spondylitis, where the hinge posture is there.
Okay. They
Yes,
were diagnosed earlier. That may be the reason.
yes.
Reduction in the calcification of intercostal muscles. This is not, madam.
And as the patient is suffering since very long, the patient came to me with the
Oh,
diagnosis only.
okay.
Yeah,
Okay,
the
but anyhow,
diagnosis.
that medicine, diet, and exercise is a very good combination.
Yes.
And when selecting, we are not selecting pathology to the person. Okay. Thank you,
Yes.
madam. Thank you.
Yes, definitely, Doctor. Jolly is an experienced campaigner, so we must remember all these things while answering. Anyway, I have a question to Dr. Vibha. You mentioned about where this animal mentioned after 80%
Sir,
of
your voice is feeble actually. Can you repeat the question?
yes, where Hanuman, as you mentioned, Hanuman mentioned some area, the organ of medicine. After 80% of changes, you can stop the medicine. Where it is mentioned?
Sir, that's mentioned where the 50 millisipal potency is, all description is mentioned now. I doesn't remember the aphorism number right now, but if you
I
want, I will
think
send.
that it is not percent is not mentioned there. I think.
I will send you that
So
the
be
PDF.
cautious. Don't use unnecessary terms. Your set is correct, but it is not mentioned up to 80% you can give. What is mentioned is there. Whenever you use an aggravation after administering the medicine in tandem, then you will stop that. That's a Lord suggestion given by Master Honeyman. Never
Yes,
said about
sir.
80%, up to 80% you can give the repeat, then you can stop. Where is it? Who said it is? I don't think it. So please refer that.
Sir,
Okay.
I read it. If you want, I will definitely show you that. Right now, I doesn't remember the aphorism number or
I'm not about
where I
mentioning about
read
the
it
above
exactly.
number, but I think it is never Hanuman mentioned about this 80% or 70%. That term is not used. That's why I'm mentioning. So whenever you witness an aggravation, you will stop the medication. That's advice. Okay.
Oh, okay, ma'am. And the session is still 7 minutes.
Yeah.
If you can tell me, ma'am, tell us the mechanism behind this condition and about some miasmatic medicine. The patient is even taking treatment with you, na, ma'am?
Yes.
Still.
See, the
So,
degeneration of the spine is there already, right?
hmm.
So the patient is, if miasmatic point of view, we try to understand, the patient is between the psychosyphilitic miasm, right? If we go on
Psychosyphilitic.
the emotion side of the patient, we understood his nature wise. If we try to understand, it's more toward the psychotic. If we see the pathological condition and all, the patient is more toward the syphilitic condition, so we can say the patient is land on the psychosyphilitic miasm.
Okay, ma'am. Okay. So, thank you, ma'am, for the informative presentation, and you have tell nicely about Kali Carb, about the notes you have shared with us Dr. Ranjan Sarkran sir, and still, if you can tell anything else.
Yes, doctor, could you please explain or your concept regarding the diet and regimen in such cases? Dr. Vibha, please.
Okay. So see, if we talk about the exercise part, the patient is on a physiotherapy. Just leave this on the physiotherapist. They are well trained, better than you. They can tell to the patient. And if we see the diet part of the patient, so the very common type of diet, like with the condition, they can't take the cold things, as the patient is also very sensitive about the cold things, right? So cold they should avoid. Other than that, sometimes what happens, if the in the pathological condition some food product is not getting aggravated, but the patient, the individual person is getting aggravated by some particular food product or something, we should mention that them also. If you are getting aggravated by any product or by any food product, you can avoid that as well. Either that food product is getting aggravated, means associated aggravation with the disease condition or not, right? So in this case, I just mentioned them, avoid whatever things which are getting aggravate to you, as well avoid the cold things. What you have to involve in your diet as well, the patient explain about his diet and everything, that he is taking the breakfast on time, the lunch on time, the dinner on time. This pattern as well represent the Kali patient, the routinistic person. They have to eat, to wake, go out on time, everything goes in time. So already the patient's diet is very good, right? And as I told, the patient is very chronic. So when they came from already from allopathic doctors, they tried Ayurveda also, they tried some homeopathy as well. Already they have their diet chart with them. So I doesn't have to mention so many things for the diet to this particular patient, right? But I just involve few things only, what I explained here, right? But patient already have with their diet chart already for the case.
Yes, definitely we should have a concept regarding the diet and regimen, because according to the patient and situation should be adjusted. According to the medicine you suggested, according to the remedy you prescribed, have to modify the diet. Then according to weather it should be adjusted. According to pathology it should be modified. So an individualistic approach is needed in not only in medicine, in selection of medicine also, but also in diet and regimen.
Yes, accordingly.
Thank you, ma'am, and a very congratulations for the informative presentation. Uh, the nowadays ankylosing spondylitis is becoming common because of posture and long sitting hours. This condition is now a becoming common. So we can aware people according to their workplace. We can aware them to sit in right posture and avoid strenuous work like heavy work and uh, continuous long sitting hour and taking smoking. Some people smoke and drink, so we can aware them to stop these things and taking NSAIDs, anti-inflammatory drugs. We can aware them to stop these type of painkillers for little small backache. So these all condition then goes to towards these chronic diseases. So and now I I think someone is raising hand.
No. I think you can conclude now.
Okay. So if anyone have any question, they can ask, please.
Time is already over, Doctor.
Okay.
And I shall say the word of thanks.
Uh,
Thank you, Dr. VIBHA Mevada Sharma, for coming over here and delivering a beautiful talk on tuberculosis. And it's really very important how to take the case and how you find the right medicine. And everything was excellent. Congratulations. Hope you can come over here and make some more presentation in the future. And Thank you everyone for joining the session. Tomorrow session from Dr. Balachandran from Chennai, and he will be talking about the eel serum and its importance in homeopathy.
Thank you so much, sir. Thank you. Always thankful to IFPH for inviting and giving a space to explain or express our thoughts and the cases. So thank you so much. And thank you so much, everyone, for your patience listening. Thank you.